I'm Jennifer Zeppelin with today's Doctor is In. Well, I've been talking with USA Health sports medicine physician Bishop Carmichael, and we're talking about knee osteoarthritis. Right. Now, I know arthritis in general, and this is one of the more common ones. So we were talking somewhat about some of the treatments.
Sure.
So talk more about some of the symptoms.
Sure. Yeah, so when you think about knee osteoarthritis, you think about people that wake up with pain in the morning. You can have pain in your knee joints with especially people that go up and down stairs a lot. We see it a lot with people that live, in apartment buildings or have to walk for a living. You can get pain, swelling of the knee joint, and you can even get symptoms like catching, clicking, popping. People say they feel a grind in their knee, and that's all a symptom of wearing out their cartilage in their knee, so their knee doesn't function as well as it used to.
So it's kind of considered, I guess, the wear and tear.
Yeah.
That's what you normally hear.
Yep.
And so who is it that's most affected by this?
Yeah, so we usually think about it in an older population. Usually ages 55 and older deal with knee osteoarthritis, but we can see it in younger people, especially if you've had a previous injury or previous surgery. Anytime you've had a surgery to the knee, it can certainly set you up to develop osteoarthritis earlier in life. But we usually say about 80% of people over the age of 55 will deal with knee osteoarthritis at some point in their life. And especially if you have family members that have dealt with knee osteoarthritis, chances are at some point in your life you're going to deal with some knee pain that might be related to osteoarthritis.
And obviously nobody wants to hear that,
right.
For sure.
Yeah.
It's, so what about diagnosis? How do you go about determining who has this?
So a lot of times when somebody comes in and you hear their story, you can kind of tell when you're talking to them. But then you get an x-ray of the knee and you can see joint space narrowing, bone spurs start to form, and you can see the wear and tear of the knee on x-ray.
So let's dig a little deeper into treatments.
Okay.
Are we talking knee replacement, or are there options for non-surgical treatments as well?
Yeah, there's plenty of non-surgical options. The most common thing that people hear when they think of knee osteoarthritis is, oh, I'm going to need a knee replacement. And usually that's several years down the line. We start with weight loss is always important. I usually tell people that every pound of weight loss takes about 7 pounds of force off of your knee. So every pound matters. And then keeping a healthy exercise routine, physical therapy, and then we start with anti-inflammatory medications that you can get over the counter, like ibuprofen, Aleve, those type of things. And then they have topical medicines that can be very helpful. And then if those things don't work and you're still dealing with pain, we can offer you injection therapies with steroid injections. And there's newer injection therapies that are coming out every day. One of the more popular ones now is called hyaluronic acid. It's like a gel injection that can sometimes be really helpful for people who've tried and failed other things. And then if we get to that point and you're still having issues, then that's when we talk about, is it time to have a knee replacement?
And so when you talk about the knee replacement, everybody's like, oh no, I don't want that done. But I've actually had family members who have gone through this, and I know probably the initial stages of it, it's a tough thing, but they're able to go back and do things like play golf or whatever, right? I mean,
that's the goal, right? To get people back to living a healthy, active lifestyle. And knee replacement and joint replacement in general has come a long way from where we were several years ago. And people are usually up walking the next day. And then there's, of course, physical therapy and everything involved. But the goal is to get you back to living an active lifestyle like you want to.
All right, Bishop, thank you so much for, giving us a lot more information on this topic. Have a great day.